right. Good morning, everyone, and happy Thursday. Welcome to the monthly California Disaster Strategies networking and organizing meeting. We're really glad that you are all here today. I am Russell Rawlings. My pronouns are he and him. I am the statewide community organizer at California Foundation for Independent Living Centers. And my physical description is that I am a white male in a power chair. I'm wearing a green shirt, have a mustache, and wearing green glasses. And behind me is the background of California Foundation for Independent Living Centers with our programs, including ability tools, disability disaster access and readiness, or DDAR, the DO Network, a disability organizing network, and Yo Disabled and Proud. And let's see, I'd like to pass it over to my co-facilitator, June Kales. June.
Hi there, Russell. I'm here in Los Angeles, and I hope I don't have a mustache, but I'm sitting in my messed up office, so behind me is one of my favorite virtual backgrounds of people wearing masks, and it's from, I think it's from the California Department of Public Health. I have graying hair. I'm wearing a red turtleneck and a ski kind of polar type jacket, and pronouns are she and her, and I never paid attention to pronouns, so I always mess up that. So anyways, that's me. Back to you, Russ.
Thanks, June. So what I'd like to do is to go around and hear from you all. If you don't mind sharing your name, your pronouns, and your organization, and as well as a physical description if you feel comfortable doing so. Would love to hear what your role is in this work as well. Feel free to share that as we go around. So I will pass to another member of our team here, Dan Oakenfuss. Dan.
Good morning, everyone. My name is Dan Oakenfuss. I am CFILC's Public Policy Manager. Pleased to be here. He and him are my pronouns. My access needs are being met. I am a Caucasian middle-aged male with blonde gray hair and black rim glasses. And my state capital, my backdrop is our state capital. And I will pass it on to Jordan.
Thanks, Dan. Jordan here. I run the Disability Disaster and Access Resource Program for Sonoma, Napa, Lake, and Mendocino counties. I'll pass it to Anthony.
Hi, everyone. My name is Anthony Lee. I am a program coordinator at CFILC, working specifically with DDAR and across programs. And yeah, thank you. My access needs are being met. I'll pass it on to Cameron.
Thank you, Anthony. My name is Cameron Moore, pronouns he, him, his, with the California Foundation for Independent Living Centers, Communications and Marketing Manager, and I am currently doing the comms aspect of the meeting, live streaming to our YouTube page. And I will go ahead and pass it over to Jordan. Jordan, go ahead. Jordan, go.
Yes, thank you. My name is Jordan. Can you hear me?
We can hear you, but you're a little muffled.
Oh, okay. Let's try to fix that. Hope that's better.
Yes, that's better.
So my name is Jordan Davis. My pronouns are she, her, they, them. I am the Equal Justice Works.
Sorry, Jordan, now we can't hear you.
My name is Jordan. My pronouns are she, her, they, them. I'm an Equal Justice Works Disaster Resilience Fellow, and I'm hosted by Disability Rights California. So my project is focusing on wildfire disaster resilience for folks with disabilities. And I will pass it to Hans.
Hello, my name is Hans Greenwald. I'm the program manager for RAL. I just came on board late last year, pronouns he, him. I am responsible for various programs, including our DDAR program out into the community, working with our coordinator. I'm going to pass it to Denise.
Denise is our captioner for today. I'm not sure if Denise, you want to introduce yourself, but I just want to mention that there is a live captioning link in the chat box. If you want to just look at the captioning, you can access the chat box on the right and view it. Thank you.
Hi, I'm so sorry. I'm not used to introducing myself. I'm just used to typing. So please continue. I will pop it over to Cindy.
Good morning. My name is Cindy Soto. I'm the System Change Coordinator at CalLife ILC in downtown LA. I use she, her, Aya, and all my access needs are being met. I will pass it on to Kelly.
Hi, good morning, everybody. My name is Kelly Hansen. I'm with CID, the Center for Independence of Individuals with Disabilities in San Mateo, California. I was a CWIC, Community Work Incentives Counselor, for about 7 years, and just recently moved on to being the newly named project coordinator for DDAR and emergency prep. Pronoun she, her, and I think that's about it. Thank you.
Thank you, Kelly. And then I just want to read what's in the chat. Liliana Atamita, her mic is not working, so this is her introduction in the chat. She is a service provider manager at Disability Resource Agency.
Let's see, let's pass to Asia.
Hi, everyone. My name is Asia Sprewell. I am the systems change advocate here at Rawlings. My pronouns are she, her, hers. I am a brown-skinned woman with purple hair wearing glasses, and all my access needs are being met.
Let's go to Carrie.
Good morning, everyone. Carrie Madden from CalLife in downtown Los Angeles. I'm a systems change advocate. My pronouns are she and her, and I have no access needs, and I'll need help to pass it along because I came in late.
No worries, Carrie. Let's go to Lisa Austin.
Good morning, everybody. This is Lisa. I am the program logistics manager for CFILC. It's a pleasure to be here again today.
Please. Next, let's go to Alyssa.
Hello, my name is Alyssa Norman. I'm with Tri-County Independent Living, she, her, and I'm the community advocate here. Thank you. I don't know who to send it to.
Let's go over to Alexandra.
I'm Alexandra Enders. I'm actually in Montana. Had a long history with independent living in California. Done a fair amount of writing, but recently I just left FEMA as I was a disability integration specialist. Still have strong interests in California. Right with June, did Moving Beyond Special Needs, and figure I'll start writing again. I'm grateful to sit in on these. I'm very interested in what's going on in California. Thank you.
Alexandra.
Pass it on to someone else, Russell.
I will. Yeah. Let's go to Goldie.
Good morning, everyone. My name is Goldie House. I'm Systems Change Advocate at Disability Action Center in Chico, California. That's it. Thank you.
Thanks, everyone. I think, did I miss anyone? Did we miss anyone?
I don't think I've gone yet.
Ah, hi.
Hi, everyone. This is Hi Norman reporting in. I'm the Emergency Preparedness Coordinator here at RCV, serving the counties from Merced, Madera, Fresno, and Tulare. Glad to be here. My pronouns are he and him, and I'm super glad to see everyone here.
Yeah, it's really great to see all of you. Sorry about that, technical difficulty there. It's really great to see all of you. It looks like we've got a crowd that is largely folks associated with DDAR programs. So it's really great to hear, I think, and be a part of a group that is very focused around IL centers. And I want to kind of take a moment because of the makeup to share one thing that was the focus of this call, and that's to share a new resource that we've got. We are putting together a public folder, a Google Drive for you all to be able to share information in. And I'm going to place a link to that in the chat. We are still building that resource, and maybe June, if you don't mind, maybe sharing some of your initial ideas and thoughts for the drive. I know they're not fully fleshed out yet, but we're working on building it. And then maybe we can transform the conversation to go more toward asking those that are here in this space what kind of resources they might want to see or need, or also be able to share.
Here, Russell. Yes, the Google Drive will be a area where we can populate multiple folders, and some of the ones will relate to past and future topic calls. For example, on the December call, we talked a lot about what might constitute fun emergency related gifts. And Alexander Enders, working with me, generated a lot of good documents that I'm still going through that we will post up there. There were documents like, you know, how do you think about the newer flashlights with LED lights that are brighter and last longer? And, you know, how do you pick one? How do you think about picking a headlamp that might be more accessible for a lot of people to wear on their head instead of holding a flashlight? So there's a lot of documents that we still need to go through and put up. And in addition, we find on the topic calls that occur on the second Tuesday of the month at the same time, the chat yields really robust information. So I'm kind of taking the best through chat and also posting that in a file folder related to the call. So that's just my off the top of my head thinking, Russell, not really ready to address this in any thorough way, but thank you. And just a reminder to sign up for those topic calls, and I'll put a reminder on the list soon as to what some of the upcoming calls are. Our next call is March 10th, and I believe it's 10th. I'm not looking at the calendar, but and then will be part 2 of a dialogue on what constitutes helpful relationships with your local emergency services and managers, and what's working and what needs work. And we're going to hear from 2 directors of centers that have been involved in those cultivation of those relationships for quite a while. So back to you, Russ.
Thanks, June. And March 10th, it will be the next topic call, correct? And likewise, these calls occur every 4th Thursday. So the next, our next organizing and networking call will be again on the 24th of March. So thanks. And again, these, we will be posting the chats, the saved chat dialogues in the folder. If you go into the networking and organizing folder now, you can find the chat from our last month's meeting, from January's meeting as well. I want to allow Samantha joined us. Samantha, would you like to introduce yourself?
Yes, sorry. Can you hear me?
We can, yes.
I'm having some sticky internet issues today. We've got a lot of ice and stuff. So I am from, I work in Oklahoma. I live in Texas. I just found these meetings pretty helpful. So I'm definitely going to check out the saved chat and the text from this meeting. But yeah, so I've just been interested in these because we've had a lot of winter weather since I've started working for the Independent Living Center that I work for. So these have I've gotten some pretty good ideas from here and just some useful information. So appreciate the time.
Great, thanks, Samantha. Just so that folks can hear, which Independent Living Center are you affiliated with?
So I work for Progressive Independence, and we're in Norman, Oklahoma.
Great, thank you so much. It's really great to have you here.
Thank you.
And Laura Rodriguez, would you like to introduce yourself as well? And Laura, if chat or if your microphone is not available, feel free to share your introduction in the chat and we will make sure that we read it aloud. Thank you. So I think given that we have so many new folks with us today, one of the things that would be especially useful is to take a moment to talk about specifically some of the challenges or again, information that you wish that you had available to you at your center or within, a collective network. So I'd love to open it up for a moment for everyone to be able to share.
And Russell June, as you think about that, I'd like to ask Jordan at some point, not immediately, but sometime in the call, to talk about her role as a fellow disability rights advocate, since some of us, including myself, have worked with many of her predecessors on really important legal activities over many decades, including the New York City case and the Oakland issues around sheltering. So love to hear more, Jordan, when you're ready to give us a summary of what your focus is regarding wildfires.
Yeah, if you can hear me okay, I can do that now. Tell you a little bit more about what I've been working on. So since my focus is with people with disabilities and as it relates to wildfires, the topics that I get to work on can be pretty broad, which I like because I'm a new staff attorney. This is my first attorney role post-bar, so that's really good. But I found that initially the bulk of our client calls are still dealing with the PSPS, the public safety power shutoffs. They're needing to find alternatives for, backup power and trying to get funding for whole home generators. So one of the big topics right now is just working on that issue, which comes up a lot on these calls because we're all trying to figure out sort of the solutions for the battery issues and the backup power when you have folks on low income or no income. And then some of the other things I'm doing is emergency preparedness, because we don't have a lot of calls right now that are directly related to the fires, which is good. But in the meantime, I've shifted that focus to preparedness so that folks with disabilities are really understanding the importance of being prepared, because having a disability, it can set you back in terms of evacuating and make that a lot harder. And a lot of folks, able-bodied folks, don't think about that in their planning. And then some of the other things, I'm working with the California Department of Developmental Services right now to try to do a training that is focused on, tailored to folks with intellectual and developmental disabilities, and pairing that with distributing go bags or go kits for folks. That's all I can think of right now, but I'd love to talk more about this offline if anybody would like to connect. I can put my information in the chat.
Great, thank you.
That'd be great. Thanks, Jordan. I know that, and Jordan, are you with Disability Rights California or DRA?
DRC, yes, Disability Rights
DRC,
California.
Disability Rights California. Okay, great. Thanks. Would anyone else like to share anything specific that they are either working on or getting up to speed on? One of the things I know, Jordan, that could be a future thing that we could talk about in this space is some support and tools to help with plain language. I know that that's something that Disability Rights California works on quite a bit, especially reaching out to intellectually and developmentally disabled populations.
Yes, we actually have a couple interns that's what they focus on. So yeah, we have a lot of resources on plain language.
Oh, I'm sorry, your microphone seems to have slipped away.
Oh, sorry. I was saying that we have interns who they dedicate their work to plain language. So we definitely have folks who are experts.
All right. For those that are newer to the space, what are some of the kind of questions? What are some of the questions that you might have for folks here collectively who have been in this work a little bit longer? Carrie, go for it.
Okay, so our center, CalF, got a grant. So Cindy and I both need to start doing presentations to our we have a action team, we call it a advocacy action team. And we need to get this started. I'm not too sure what is the best way to start educating people on it since I'm so new to this myself.
So let's brainstorm a little bit. What have folks done to help educate people in their local areas? I know there's got to be someone here who has done outreach and education work.
Hey, Russell, Jim, maybe I'll answer your question. I'd like to also tack on. What have you all done in terms of working individually with members on their emergency plan related to helpers or their evacuation plan from their home or from the area? You know, we've talked on topic calls over the last many months about different kinds of go kits and how realistic or unrealistic they are. So I'm just curious about your not only the training you've done, but how you work with people individually and what's that been like, what works and what doesn't work.
I feel like the majority of what I've been doing is just working with individuals on their plans, because it seems like it's difficult to work with, or not work with, but know other service providers that are doing this work. So it's like there's nobody to share resources with, or even like, I mean, just creating our own documents like checklists and, you know, emergency preparedness handouts, things like that. It's like, it's all us, it feels like. So so we've been working just each individual client, and it seems very slow going because, you know, it works better if you have a whole group together, and then you can do some sort of presentation and do handouts. But yeah, it's slow going right now. I don't know if that's how it is for everybody else.
I think that may feel a little bit how it is for a lot of folks, but I'm curious, has anyone on the call put together a presentation that they've done for a group of individuals or any of those kinds of things? I see Jordan has shared in chat. I've hosted an online training that was interactive and introduced the idea of preparedness and what simple steps to take to start planning for a disaster. I try to incentivize participation with giveaways. And Jordan, do you, some of the material that you've used, is that, where did you pull that from? Or is the, do you maybe have some materials that you could share with us in the, that we could post in the drive? And while we're waiting for a response there, I want to go back to Carrie for a moment. Carrie, what are the specific goals of the outreach for your grant?
Let's see. It escapes my mind right now, unfortunately. Cindy, do you remember what Keith gave us the other day?
What was your question, Carrie? I didn't quite catch it.
The goals of the grant that Keith went over with us the other day, do you remember what they were?
Oh, I'm sorry, I do not.
Okay, well, if you come back to us with some specifics, maybe we can help you brainstorm as well. I see that Jordan has posted, I pull guides like Listos California and try to make them even more simple and plain language if possible. And Jordan has to go now, unfortunately. And thank you for sharing with us today, Jordan. So what about Go Kits? How many of you here are putting together Go Kits for your community?
Russell, I could talk a little bit about Go Kits and RSCV. So for RCV, here at RCV, we do definitely give out Go Kits. A lot of our stuff, because we are a independent living center, we do have lots of other flyers, lots of other programs. So definitely that's the first thing that we include. Another thing that we would include in my Go Kits are definitely, I have this first aid kit. I think it's I totally forgot how we got them, but then we got about maybe 200 of them, and we were able to give them all out. They contain things from like compasses to lasers to, lasers, first aid kits, basically all the good stuff. And I think they're one of our more popular ones too. Aside from that, let's see, we also have the solar powered lanterns. I think that those are really key to have, especially when you have a population that lives mostly up in the mountains where the power goes out very frequently. Let's see, what else do we include? Oh yes, we work together with Listos from United Way, and they've provided us one of their huge roadmaps. I don't know if you guys have seen it, but it's like a flyer that you can open up, and it's a huge map. It tells you, what you should have in your go bags, what you should have in, state boxes, all that information. And I think all that stuff is very key to have inside of like a go bag, just to help our consumers, be able to be prepared for any type of emergencies. Definitely, we do have a lot of other flyers as well, but those are more just like general information flyers. And I think we talked about emergency planning, personal emergency plans. And I think that's something that our DDAR program does very well, where I'm not sure if a lot of us have talked about it, but I think we definitely do have lots of programs, lots of, strategies of how to plan. So definitely that's something I include in my go bags too. And yeah, I think that's it.
Thanks. I also see, June, you shared something in the chat, a chapter on case use, on case management has some detailed content regarding individual emergency plans. June, do you want to go over what the document is and where folks, I know we can put that on our drive too, but just
yeah, sure. But I wanted to stay with the Go Kits a minute, because I think I wanted to just kind of add some controversy to the discussion of Go Kits, just to kind of, make it more. Let's get into this Go Kit stuff just a little bit. I recently have been reviewing some of the content of a Go Kit put together by a national organization for people with significant disabilities, both in terms of, any upper body strength or motor control, or including, all of that. And I'm obsessing about what's in the kit and how useful they are. So I'll preface this by saying there's a lot of things in the kit that are really good, but in terms of using some of the content independently, I'm going back and rethinking, or I think we all need to rethink some of the applying disability to what's usable. For example, in one of the kits is this really handy little, it's a jackknife I'm showing. So me, who has CP, if I try, I can't open this. I don't have the motor skills to open this. So anyway, this handy little headlamp is not bad because it's really easy to turn on, and you could probably do it with a closed fist. Let's see, I don't want to blind anyone, but Well, that's good. It's not turning out. Oh, wait, wrong sec. Hang on. Close fist test. Nope. I can't turn it on with the closed fist, but I can turn it on with my thumb. So just things to think about. It had some straws in it that were covered straws to protect them from getting dirty, but the cellophane on the straws easily tear in a go bag. So I'm just asking you to think more deeply about usability of what's in a go kit. I love those lanterns that somebody just mentioned, but I had to actually call CFILC and say, I can't open it. I can't open it myself. And they spent Lisa Austin and they spent out, I think it was Lisa, somebody and Christina, they spent a lot of time with me trying to help me figure out how I could open it. So anyway, just a thought. The other thought I'd like you to think about is, I'm not sure we have any good information of, are these go kits actually used, or are they rated and then forgotten about forever? So I just want to add that granularity to the mix of discussion. That's it. And then I'll go back to what I posted later because I wanted to stay on your go kit question, Russell.
Great. I think I've got some ideas. Also, Kelly has shared in chat, we have been distributing emergency backpacks to seniors and individuals with disabilities. It has things like a box of disposable masks, plastic face shield, hand sanitizer, and first aid supplies. So those are definitely things that are useful right now. Alex.
Yes, the Go Kit issue, I think putting out contents in a Go Kit that either aren't going to be used, are inadequate, are inaccessible, whatever, provides a false sense of security. Oh, I have a Go Kit, except for the bottles of water in it, perhaps. You know, June and I have discussed the contents of Go Kits, etc. And one of the questions I keep posing is, where are you going? It's like, you know, the kind of stay-at-home kit is different than the I'm leaving right now because there's a fire in my house, and everything in between. And you don't always know where you're going, but you probably have some sense of why you're leaving home, where you might end up, even if it's just, I'm going to end up on the street watching my house burn down. I think that merits more discussion. I think, June, you said that one of the content sessions was going to focus more on that this summer. But I think one of the most important things for everybody to have in their Go Kit is to have their essential paperwork in a digital format, even if it's just in a jump drive, scanned and put in. And I'm curious to hear if any of the CILs are helping their consumers do that. I mean, you need to have things like your insurance papers, at least the top form, so you've got the number, both your house insurance, renter's insurance, car insurance, any other kind, health insurance, any kind of insurance you've got, you need to at least have the numbers. Things like last year's tax form, if you're in any social service programs, any of the paperwork you've got with that, it's like, in some ways, trying to reestablish your life afterward. If you can't get back into your house because of an earthquake, a fire, whatever reason you can't get back in, you know, you evacuate in a wildfire, you're not getting back into your house. Having your essential paperwork scanned, and it seems like that is something that CILs might be able to assist with the scanning, getting them on jump drive, giving people the jump drive to take with them. I had suggested that it might be interesting to work with the area agencies on aging and the aging and disability resource centers, is when they help with tax season, tax preparation season now, to actually, since people are having to pull their paperwork together anyway, to bring the paperwork in, have it scanned, put it on a jump drive. And I mean, that is such an essential element of your Go Kit for proceeding on with your life. Everybody wants all this information, and if you don't already have it on your phone, in a protected place so other people can't get at it, it seems like it would be a great service for CILs to provide to their consumers. Is anybody doing that?
Yeah. I think I'm curious. But there's a couple of quick comments that I'll read from the chat here. Kelly Hansen has also mentioned that they are a member of the CERT in their area, Community Emergency Response Team. And then there is a link to the section of the CERT training manual that has some information about outreach. And I think that that's really, really helpful for those that might be putting together an outreach presentation. Earlier, I know that we had a pause where folks were looking at developing training materials, and Carrie and Cindy, that might be a good link for you all as well for getting some ideas. Hans also shared, we have been distributing emergency kits to individuals who have participated in one of our virtual disaster preparedness workshops. So kind of as a part of participation, they're receiving the kits. Kelly, go ahead.
Hi, yes, I just wanted to mention that's the entire training manual. Like it would take quite some time to go through the entire thing. But the good thing about it is, if you know that if you're putting together a presentation and you know that the group that you're going to be speaking to, that they're primarily interested in one topic, whether it's earthquakes or fire or, whatever disaster, you can go to that CERT manual and you can find very specific information, even about putting together Go Kits and, and like I said, this is the manual that's used everywhere in the US. It's, produced by FEMA. And I really just recently found out that it's the same material that's used for all CERT training. So yeah, I just thought it might be useful, so you can kind of pick what might be valuable for your individual presentation. So that's it.
And then I want to kind of follow the thread a little bit to June's question too. And, it's always a question of, if we are giving out tangible Go Kits into the community, how are we following up to make sure that those things are usable? And my question for those of you that are putting together Go Kits, I don't think it would be too challenging to put together a survey that you could put in there to say, this item that's in the kit, like item number 1, how useful was it? Were you able to access it? Those kinds of questions. Because then if you're getting a bunch of feedback from your community that, like, say, for example, the flashlight that June was showing us, I don't think I personally have the physical dexterity to be able to operate something like that, or at least I doubt that I do independently. So I would share that feedback. And that's not to say that they're not things to include, but it's just something that maybe with that person you want to say, okay, what's a separate solution for a Go Kit for you? Maybe a voice activated solution or something, We also have the Ability Tools program here at CFILC. So June, I have a feeling that you got an interactive one-on-one session with the best minds of all of our Ability Tools staff, probably, and everyone else to try to help you solve some of your needs. But that's sometimes that's what it takes, right? Like we can't imagine that one size fits all solutions are always the best. But I think having a little short survey, and maybe that's something we could think of as a group, is how to say, okay, here's what's in my Go kit. How would I put together a survey to ask the community how useful or how accessible the items are?
Hey, Russell, June, I want to just add to what you said and say, yes, that would be great. But I would, as a, in order to get a Go kit, I would suggest that any of you who are still distributing them require who they're given to and their email address and at least a agreement that they would complete a survey maybe within the first week or two after receiving it, and then 6 months, and then a year. And there's no guarantee here, but at least you don't rely on just them doing it. You ping them by email. And so I like that idea a lot. I think we could be a lot more, be our own little quick and dirty research, but I think would also really inform what constitutes, usable emergency stuff for who. I love that idea.
Thanks. I think there's good chat as well. Liliana has shared we have not provided any Go kits, but thanks to everyone who's sharing what you have included in the kits, gives us great ideas. And then Kelly says that's exactly what we do, obtain a demographic form from each person who receives an emergency kit. And Kelly, do you want to kind of maybe share a little bit what that looks like for you all? What does the whole process look like for you?
Give me just a moment here and I'm going to find it and pull it up. I'll come right back to you on my answer.
Thanks. I also want to highlight Alexandra's brilliant idea. So I'm going to extend it a little bit beyond the idea of just tax preparation, although that's a great one. I'm not sure how many centers actually directly assist with tax preparation, but I'm thinking at every intake, every opportunity that an ILC gets to have a conversation should be one where there's an opportunity to share information for the purposes of emergency, right? Like, so for example, if you're bringing in a whole bunch of paperwork for a Social Security meeting, it makes total sense that ILS staff might say, hey, have you spoken with our, our DDAR coordinator to see if some of these things, we might be able to make them available to you in a way that should there be a disaster, I think digital format is good. I also think maybe even having like a physical copy that's available in like a safe place, or maybe I know fireproof boxes might be a bit expensive and difficult for some folks to get, but just thinking about a safe location, even reminding them too that their ILC itself could be one of those, like if something were to happen and you had to evacuate and you have nothing, right? Just know that your ILC might have backup copies of some of that stuff in your file.
Hey, Russell, June, I would just ask us all to rethink or think hard about a scan drive, a thumb drive, whatever we call them.
Yeah.
There are more and more organizations that are not permitting us to plug our thumb drive into anything they have, any of their devices, any of their computers. And so I just think we have to explore that as well. What we can always store it in the cloud, and that may avoid their fear of digital contamination or whatever it is. So I think we need to look at that too.
Right. I see that Carrie has shared that CalLife's grant is for us to give disaster preparedness on climate change, fire, flood, and windstorm damage. So I have a feeling that that there are some folks, maybe not on this particular call, but in the future, we can start brainstorming about regional efforts. I know that Cal Life is in downtown LA, for example, and maybe June, you might even know some local area resources for the LA area that Cal Life might be able to network with to do some outreach.
Mhm.
So maybe we can, I think that's another need too I'm identifying, is that folks would like to have like other organizations, and Listos, which was mentioned, is one of those organizations. I'm not sure what their regional capacity looks like, but I know they're a statewide effort. And June, have the folks from Listos ever participated in one of the topic calls?
Yeah, yes, and there is basic Listos information, I think, on websites, and their call for new grants is open right now, and I know that some of you will be competing for that money. So yeah, they offer basic disability preparedness information, but we've talked at CFILC, at least, in terms of how do we complement and augment that information so that it's really customized to who we're working with and talking to.
Alexandra has shared in chat. We can post the standard list of paperwork items to save. But following on June's point, what specific disability-specific items like SSA paperwork should be included? I think that's a good question for the group.
How about a medication list?
Medication list would be very important, I believe. And to that end, I think like a specific list of like doctors, like contact info for doctors, and any kind of some people might be using portals for like accessing doctor information. So it might be, you never know when things are going to go awry. So you always want to make sure that you have access to your passwords, especially for logging into your medical portal stuff, if that's how your medical provider operates at all.
June, I recommend a hard copy of phone numbers and immediate addresses of places you may end up going to during power outages. You might not need their email right away, but just the other documents that are on my list is a document that includes the make, the model, and the serial number of any life-supporting, life-sustaining equipment, and any repair, contact people, type of battery, any information about alternative ways to charge it, any relevant sections of your manual that kind of show you where things are for a quick repair by maybe a handy person who doesn't know DME, durable medical equipment, really well, but is very handy, knows how to think, and if he can look, she or he looks at a diagram, might be able to help. So that kind of thing. I think we sometimes forget about that.
Yeah, that's absolutely true. Kelly has shared that on the demographic form that was mentioned earlier, there's a place for name, contact info, ethnicity, race, primary disability, disability type, such as cognitive, hearing, mental, emotional, or physical. And we ask if they are interested in learning about other CID services. And then Liliana has shared SSA award letter for income purposes. what other kinds of what other kinds of items or pieces of particularly pieces of information as well. What kind of plans have people helped people think about for storing? And these days, I think personally one of the most available devices is always a person's phone. And the simplicity of just going through and taking photos of so many of these items is so powerful as well. I mean, I know it can sound a bit ridiculous maybe to take a picture of something that's really common, but it's so easy to flip through those photos and find it and access it. And a lot of times now, these things are just instantaneously backed up on the cloud for people too. So even if your own phone is damaged, you get a new replacement phone and you can log back in and download all of that stuff.
Excellent idea.
So these are, and these are things I think that maybe people haven't thought of themselves and can be part of the conversation when having that, one-on-one, the initial assessment or similar opportunity with staff.
And I have if you're an iPhone user, this June, and your pictures do go to the clouds, and you can create subfolders called albums. So I have one album called Kiwi. Keep it with you. Picture of my license, picture of my passport, picture of my car insurance ID, picture of my latest COVID booster, whatever, picture of my prescription. It's a whole lot easier. I think you're right, Russell, to just, you take the picture, have someone take the picture, because it's always with you. Kiwi, keep it with you. You always got it right there. Of course, if there's no power or no cell tower, but then we're back to a question of what is an essential hard copy? Since we can't carry a lot, what would be the most essential hard copy thing to carry of these so-called documents?
Love that. I love the Kiwi. I love keep it with you. That's a really great thing to just kind of, I think, maybe even that's probably a great thing to put out. And I think if your organization was gonna put out a go bag, maybe just ideas like that Kiwi, even, there's value in having inside a go kit, not just the items that you'll need, physical items, but also kind of reminder items that folks can remind themselves of. And that's also a good opportunity, of course, to say, go through your go bag every once in a while, make sure everything's working, make sure everything's good, and check that checklist. And part of that checklist should be the, thinking about your Kiwi items. I also see that Anthony has shared the link for the SurveyMonkey for this call. That's a survey that we'd love for you to fill out. We will also have an in poll or in meeting poll toward the end of the meeting as well. Alexandra has shared a copy of a child's IEP. We found out after Hurricane Harvey that not all school districts had an electronic system for record storage. And so there was not a way to get a copy of the IEP. Excellent idea. What kind of thoughts do others have about either Kiwi items or anything that should be in that go bag? What does a go bag look like? What kind of interesting conversations have you had with consumers, Kelly?
When I was going through CERT training, one of the things that they mentioned was that a lot of physicians will go ahead and add authorization for a prescription so that you can keep it in your go bag. That's kind of like good news, bad news. I mean, the good news is that you can have spare medication in your go bag. The sort of bad news is that you really have to monitor that and make sure, because I mean, you don't ever want to have to use your go bag, but you definitely, if you are going to use it, you want to make sure that that medication is still active and, usable, that it hasn't expired. So that was just something that I thought was interesting, that physicians will issue an additional prescription just specifically for a go bag.
Cindy.
What about things that you're allergic to? So a list of that.
Yeah, list of allergies. I think that's an important thing. And this goes another level further. It's always important to think about, what are the things that you can have with you when you are, if there's a case of an emergency, there's also a case that there could be an injury. And I think, June, maybe, I don't know what kind of discussions there have been about kind of support teams, or what helping people think about what their support team looks like. But that also might be a really good conversation about, like, for example, some of your Kiwi list might be things that you might want to say, hey, you're my trusted person. Here's my list of things that I would want anybody that's helping me to know.
Yeah, good idea. I want to just mention that Kiwi is a little different than go bag. Kiwi means you will always have it with you, always, always. Not just in a go kit somewhere, like right. Some lawyer. I remember I was at City Hall one day, and some city attorney was challenging me about how prepared people with disabilities are for emergencies. And I said, well, why don't we have a contest right now? So, or why don't we talk about it right now? Do you have a go bag? And he said, what's that? I said, okay. I said, I have to go back, but guess where it is? It is 5 ground levels below the ground level, and we are on the 25th floor of City Hall. So let's talk about what you have with you right now and compare it. So, I whipped out my little Kiwi list on my phone. I whipped out my little micro flashlight connected to the scooter key. I whipped out the poncho tucked into the seat of the, anyways, I just kind of rode over him. So just a fun story.
So yeah, I mean, and that's how it works, right? Like in many cases, because you had put thought into some of those things in advance, you were able to respond. Some people, they just haven't been challenged in the right environment to think about, what they actually have. Like, so I'll be honest with you, some days my backpack is full of things that I'm just like, what's even back there? I don't remember at the moment.
And I want to mention that what's in our daily backpacks is something that we have to integrate as we think about a go kit, because a lot of the stuff in our daily go bag is not something that's going to come out in an emergency. We need to add to it. So how much room do we really have? What can we really carry alone, independently?
All good things. Any other experience stories folks would like to share? Has this given anyone inspiration for some sort of action that they might want to take?
I think I'm noticing just with all the conversation and the chat that it seems like, maybe I'm thinking it's really a lot more to it than what a lot of the people with disabilities that I know of already have on them day to day. And already, like, it seems like people with disabilities are very prepared in general, and just because we need to be all the time. And so maybe for like the presentation that I'm thinking of, I maybe need to downscale and just be like, keep it simple and say, like, a lot of the stuff you already have on you, and we just need to grow on that. So I think that's probably what I'm going to do with that whole thing. So I appreciate everybody's comments.
Samantha. And yeah, I think, in spaces, people with disabilities, we tend to think, big picture, right? Like as many of the variables as we can possibly think of. And I think that's kind of our superpower, is that we're always thinking about the what if, and but certainly I think that these conversations can be broken down into pieces. And I think probably that CERT manual is one way to kind of think about doing that, by section area. And also even just in the conversations that we're having, like I've heard that there's a couple of different layers to just thinking about something as simple as what a to-go kit, or even just the general sense of what do you do to prepare? Like how prepared are you at any moment, And June, you shared a concept I think that's really helpful, is that Kiwi, to know that you have a set of things that you always have with you, just that those are like your forever. It's almost like the keys to where you live, right? Or where are the food, that you eat every day, where that stuff is. Alexandra.
Yes, I just brought a book called 52 Prepper Projects, a project a week to help you prepare for the unpredictable. One of the really good points that he makes at the beginning is it's expensive to pull all this stuff together in a simple go kit that you're giving with a few items is one thing, but the more comprehensive stuff, or stuff you're keeping in your car, can be very pricey. He actually had, he does this for 52, one at a week. He has a list at the beginning of each week of what you should buy, because to spread the cost out over a year, and that includes things like 1 can of canned meat per person, 1 can of fruit per person. And then he's got weeks that you buy batteries and other things. It would be really, I think, useful to look at some of this stuff from that perspective of how you can spread the cost of this over a period of time. And I think one of the disability specific things on that is how, maybe this isn't an issue in California, but how do you get an extra supply of prescription drugs? If you're on Medicaid, what do you call it in Medi-Cal? Pulling that stuff together, and it becomes more manageable that way. It's just such a big, oh my God, I can't afford to do this. So I don't know if that's something IELTS could assist people with thinking through, or if this group could put together something like that, but I think it would be useful.
June, Alex, I can't resist. I think we have to be really careful about that, because I think that kind of thing can really alienate people with no income, or people in low incomes who are living day to day, hand to mouth. So I just think we need to use some very sensitive filters before we make that real popular in public, because people get, they exclude themselves. They go, well, that's not me. I have no extra money at all. And yet a lot of what we talked about today, the cost is time, not money. All this Kiwi stuff, It's really time, not money.
Yeah. Also, I just can't understate the value, I think, of having the conversations, you know, just really getting, Alexandra, you asked, or you put into chat, the downside of digital copies of info is confidentiality. If you lose the hard copies, the thumb drive, your phone, your passwords, someone else has your entire life. There is a case to be made for having a saved copy offsite with a trusted person outside the likely perimeter of wildfire, earthquake, flood, and then update the backup periodically. This is a good sharing strategy. They save yours, you save theirs. This is a basic data backup principle. Save a copy at home, in the cloud, and a copy offsite. That's really great. Kelly has shared, I love the Kiwi plan. I'm going to explore ways to promote that, and asking Alexandra for the name of that book again. Alexandra, would you mind sharing the name of that book?
Sure, I'll put it in the chat. It's called 52 Prepper Projects. I just bought it on Amazon. And, you know, I mean, one of the things I think he stresses in the book is that, and I've said this before, it's like the prepper community's into this stuff, but also folks who have wilderness survival skills. He keeps pointing that out in this book too, about a lot of those things. I mean, if things go sideways, knowing somebody who's got those skills would be useful. But some of the stuff from the prepper community, then augmenting it, as June says, with disability specific things that they may not be thinking about, that would be a very interesting meeting between those two communities, because I bet a lot of the stuff, as you pointed out, Russell, it's like they may not have thought about a lot of the stuff that people with disabilities think about all the time. That the community could bring a lot to the conversation. It wouldn't just be one way. But I'll put the book in the
We're down to our last 15 minutes, and I think I'll ask the group here too. So for next month's meeting, what are some kind of next ideas or resources or other things that you might want or to have the opportunity to share with one another? Yeah, go ahead, Cindy.
Okay, what about how to find out if your county or city, town, how prepared are they to help us? Like, do they have accessible sleeping cots? Do they have enough portable restrooms, that sort of thing?
How to make an assessment of what community resources might be available.
Yeah, exactly. Thank you.
Great. Yeah, June, do you have any kind of initial thoughts? So let's say one lives in the lovely city of Los Angeles. What in the world, like, how would you even start researching something like that?
Well, probably in LA, if you lived in the city, you call the city emergency management department. And for example, if you had a question about how do you determine which shelters are accessible after when they need to be used after the emergency, and how will I learn about which shelter to go to and be assured that they are accessible. And those are the kind of questions that should be put to them. And, you know, lately I used the strategy of submitting some of these questions in writing by email, so I get written answers, because I think they're a little more, they take more time when they have to put stuff in writing. Just a thought.
Excellent. I mean, I honestly am a big fan of get it in writing, because then your organization can sit back and look at it. You've also got a physical copy of it. So I agree with that. Maybe the phone call gets the conversation started, but you say, can you put this in an email? Would love to have a copy of this. Also, I know that LA has a, I'm not sure if it's the city or the county, but there's a whole department on disability, correct? An office.
The mayor's office has an office on disability, but I would want to go right to the source.
Well, yeah, exactly.
Yeah.
Exactly. Push on both, right? Say, ask that office, like, what do you all have on disaster? And if the answer is crickets, then you say, well, I've already found this and this with the other departments within the city and area.
Yeah.
I think the biggest problem with local government sometimes is that there's so much great work being done, but it's being done without connectivity. Does that kind of give you some ideas on where to maybe start, Cindy?
Yes. Actually, our center sued the city of LA for their lack of emergency preparedness some years ago. So, but anyway, it's always good to check in again. Right.
Hey, Cindy, I forgot you asked that question, but for you specifically, what the question I would like to, maybe we can talk offline, but it's like, what happened to all that hard work we did with the city after you guys sued them? Because the question is, has it been maintained and has it been embedded? So I think that if you or we crafted some really focused questions to send them, it might alert them that we're still watching, because the problem was with that lawsuit, when it's over, and people stop monitoring it.
Very true.
Plus, I think these things could serve as an inspiration, Gene. So while it's important that we do that in LA, we need to remind ourselves that this even happened and do maybe a lessons learned, and also, maybe where we were and where we are now, compare and contrast, and also ask ourselves, how does this translate to an area like where we know wildfires exist, or where we know that, these threats are not just in LA.
Right. I'll contact Elizabeth and get back to you on that. Okay, June?
Great. Yeah, perfect.
Thanks. And Alex, I see that your hand's up. Samantha asks, is anyone in contact with local ombudsman? Samantha, could you maybe go into detail a little bit more about what you mean by the local ombudsman?
Yeah, sorry, my autocorrect is doing fun things. But yeah, I didn't want to bring up a whole new thing right at the last bit, but just wondering about working with different nursing facilities and working with them on getting an emergency plan, because I'm sure that there's still a lot of places that don't have, even after all of the chaos and catastrophe. So just wondering about that.
that probably in itself is a whole contained issue that June, I'm curious, has there been any work with kind of coordinated around, state level or even national level coordination there?
Sorry, Russell, I was multitasking by reading chat, and so I didn't quite hear the question.
That's all right. The question was more focused around interacting with local ombudsmans around, I think, kind of facilities that operate that people with disabilities might be in. Obviously, independent living centers, we're trying to get folks, help them have community options, but for those who don't, what kind of coordination and interaction is there, kind of holding accountability, I think, with kind of institutional facilities?
Yeah, I think that's some time for another call, but just a reminder that frankly, at least 25% of the people who died from COVID were in those institutions, and whatever ombudsman or whatever is in place is totally inadequate, and the fixes will not come soon and will not be enough. So our focus has to be to help facilitate whoever we can who's able to get out and stay out. And then the other is who's ever left in there. I mean, that is a huge systemic fix that has multiple layers that have not been adequately addressed in the last many decades, and will not be a quick fix.
Yeah, I think that's adequate picture of that situation. All right, I'm going to go ahead and launch our poll here, and we'd appreciate maybe if you'd take a few minutes to complete it. It's a pretty quick poll. I'm going to put it up on your screen now. In the meantime, though, if someone would like to continue to offer future ideas, there is the poll. If someone would like, or if folks would like to continue to offer ideas for our next session, feel free. If there's also any topic calls that you'd like to hear, feel free to voice those. We will, at our next meeting, review the changes to the drive. We'll be adding some resources again that you all have shared. And June, is there anything that you wanted to add?
No, I'm just intrigued by this poll technology.
Alex, your hand's up.
Yes, for a future discussion, there seemed to be an increasing number of groups interested in disability and emergency preparedness or management. It's like, how are they kind of connecting, coordinating? I mean, here I am in Montana, somebody else on the call is in Oklahoma but lives in Texas. It's like, Washington State often participates. It's like there's these different, you're getting, and everybody's interested in California because of the power issue. And it's like, how does that all kind of come together? How does your group fit in with it? I mean, there's the daily partnership calls. Then Dawn Brantley, who's the acting emergency management director in Massachusetts and a strong background in access and functional needs, she's just formed this inclusive emergency management group, which is open to anybody. I mean, ACD has a subcommittee and grants on it. Different ones, different participants in the National Disability Rights Network are active in this. I don't know if they have a subcommittee. April, the Association of Programs in Rural Independent Living, just started a working group. I don't know if Nicole's going to come back with theirs or not, but there's how can we kind of coordinate? connect? Or how are you connecting? You probably already are doing it. But especially with like the resources and sharing, how is that working? How could it work? Could that be a
Alex, we do have a topic call with the partnership, who's a major coordinator of all this, and we do have a topic call with WID coming up, who also plays a role in all of this internationally. So that's two ways. AUCD is not been on our list as yet, but
how about April and Nickel?
Nickel is not functioning right now with that committee, but in April's committee has not yet started, but after it's been around for a while, that will certainly be a focus of a good topic call, good idea. And
how about other states, like, you know, the person from DRA is on this call, but isn't that an activity in other states too? It's like connecting all this stuff. And you know, California has certainly shown amazing leadership, which is like why I like to sit on these calls. But you know, this power issue is going to keep coming up, and everybody's got their eyes on you. I mean, there's a lot of it. This reminds me of like the early days when everybody was collecting resources, and to keep us from doing that again, they need to be better categorized and vetted, instead of having this, you know, 59-page list of all the resources around disability and emergency management. How do we do this nationally and across, and so it still maintains a state, and then even more important, the local issue, which is why the ILC network in California.
I think, Alexandra, you bring us a great, I think maybe it can be summed up with, you know, organizing the organizers. And sometimes that is a big task. So perhaps maybe we can have a brainstorm between the topic calls that we've got coming up. Maybe we can seed those with really good questions for WID and some of those folks that are in the position to do that. But also, I think, you know, kind of maybe even just collecting who are these professional, you know, who is this network, really the big network, and putting that together would also be helpful. So, all right, well, thanks, y'all. I want to be acknowledging that it is 12:01. So thanks again, and look forward to joining you again on the 10th. And our topic call this time will be, June?
It will be working with emergency management departments locally.
Great. So it's look forward to seeing you all for that. And then I'll see you again on the 24th of next month for our next networking and organizing session. Thanks, everyone.